Well, to discuss this, I'm joined now from Copenhagen by Rob Butler. He's a World Health Organization Program Manager with the Vaccine, Preventable Diseases and Immunization Division. In Brisbane, we have Allona Lahn. She's an anti-vaccination activist and a natural health advocate. And completing our panel from Tokyo is Dr. Riko Munaraka. She's a medical doctor and journalist. Thanks so much for joining us. It is World Immunization Week. Rob Butler, the question I want to ask you is not scientific, it's not medical even. It's more about, should people who don't want to vaccinate, even though there's overwhelming evidence that immunization works, vaccination works, should people who don't want to do it for themselves or for their children have the right and the choice, or should they be forced to?
I believe that they should have the right to be vaccinated. I believe that every vaccine program should be voluntary in the sense that people have a choice. What we also believe, of course, is that people should make that choice based on balanced evidence and to make an informed decision about vaccinating themselves or their children. So, as you've said, it is World Immunization Week. It's a tremendous week to be celebrating the potential and the success and celebrating the undisputed overwhelming support of vaccination globally today.
Okay, so Allona Lahn, we didn't bring you on here to sort of go toe-to-toe with doctors and scientists, right? In a sense, it was very difficult for us to find people who were anti-vaccination, but it is a movement, and in some places a growing movement. When people say, okay, listen, you can do whatever you want to do for yourself or for your children, but when you decide not to vaccinate, especially when you, for example, put your kids in school and you decide not to vaccinate them, that increases the risk of things like measles and polio coming back into communities where it was eradicated in the past. Don't you have a responsibility to say, hey, I have a duty to the collective good, I'm going to go along with this, even if you don't believe in it?
Look, my story is I had the hepatitis B vaccine at the age of 21. I went in for a pap smear, had the vaccine instead because they told me I was at high risk of getting hepatitis B here in Australia. Within months, I was covered in eczema, autoimmune issues and severe allergies. So I'm going to reverse the table here and say that vaccine manufacturers and those that push vaccines should have the responsibility to make sure that the vaccines are 100% safe and effective and that they actually work. So when people are damaged and injured by vaccines, we're forced into it regardless of that, which is coercion and intimidation. So do I have the social responsibility to be vaccinated? No. Okay. No. If vaccines work, then I should not be at risk.
Okay, so I want to bring you in here. We have somebody on the panel here saying that vaccines are not 100% solid. She doubts it. Would you agree that vaccines are not 100% effective? Or would you find a way to try and convince her? Here's an opportunity. You're a specialized doctor. You're an accomplished doctor. Here's somebody who's skeptical of vaccinations for herself and for her community. Prove her wrong.
It's very difficult to persuade a person to appreciate what vaccine could do to what kind of benefit they could give to the people. But all we could do is to keep them telling that it is much safer to be vaccinated than being infected to obtain immunization. That's the only answer that we could tell them.
Right. Rob Butler, the UN saying more than 1 million children still die every year from vaccine-preventable diseases. To what do you attribute this resistance to vaccinations?
Well, the first thing we should clarify is that these millions of people are not vaccinated is, of course, a tragedy, but is not because there is those millions of people are necessarily pushing back against vaccination. Plenty of people do not have access to vaccines, particularly in the less developed world, in the developing world. Additional to this, even in Western European, where I'm sat today, we have issues with people's complacency around the diseases that the vaccines prevent, because we haven't seen these diseases in our communities for many years, in many of the Western European countries particularly. So there's an element of complacency here. It's not all about confidence and trust in vaccines. There is complacency and access issues that are also playing out. I think the important thing we've got to remember here is the vaccination programs around the world save 2 to 3 million lives a year. Vaccines have eradicated smallpox, and we have now got the endemicity for polio down to just 3 countries. That is a remarkable achievement. Can you imagine the potential when we talk about other diseases that are vaccine preventable? Yes, of course, it is not 100% safe. Nothing is 100% safe. Getting into your car in the morning, crossing the road in the morning is not 100% safe. No medical intervention is 100% safe. The difference here is that we give vaccines to healthy children, as you're seeing on the screen at the moment, healthy children that are not sick, to prevent them becoming sick, so that they have every opportunity in life to go to school, to develop physically, and to ultimately be productive, happy, healthy citizens in the future.
Allona, you have to be convinced by that, right?
No, I'm not convinced.
Tell me why.
There are no long-term studies on the effects of the full schedule on children. There are no long-term studies. As far as eradicating diseases, why is has the World Health Organization just recently said about the vaccine-derived polio virus? Why is there a vaccine-derived measles virus? And what I want to know, in all those people in all those third world countries, it's actually sanitation, nutrition, clean water that actually has saved humanity. You are going into third world poverty-driven countries, and they are the people that are dying of disease. And you are then going into these malnourished people and then giving them disease injections with disease and toxins with ingredients that should never be injected. And that is actually a disgrace.
Okay.
Have you eradicated disease, or have you actually...
So let me take that and ask Dr. Riko Munaraka. Dr. Munaraka, there are some, like Allona, who believe that it's not so much the vaccinations, it's more just the increased standard of living, sanitation and other things, nutrition, that you can attribute to eradicating diseases and not the vaccinations themselves. I've heard it elsewhere, I've read it elsewhere as well. Is there any truth to that? Well,
of course, by improving sanitary situation or other conditions, we are fighting back to the disease. But still, for example, like measles, once you get it, even you're either you're vaccinated or not, there is no cure for something like meningitis or SSPE that can be developed after years after the infection of the measles. Some people could die or will be left in very serious medical conditions. So vaccine is the most effective way to prevent from being sick or being dead because of the result of the infection. Of course, you get the strongest immunity by being infected, or you protect yourself. Well, everybody else except you are immunized or gained immunity. You can be safe, but that's not possible.
Right.
Everybody has to be vaccinated to get herd immunity, or as a society, we have to be vaccinated.
Rob, let me ask you about the celebrities. And no disrespect to you, Allona, there are people with a higher profile than you who are anti-vax. Even up to the most powerful person in the world, Donald Trump, has hung a question mark over vaccinations. There's Jim Carrey, there's Jenny McCarthy, and a whole bunch of people. Rob, as somebody who works for the World Health Organization involved in vaccinations, how much more difficult does it make your job that high-profile people are telling others, hey, listen, this might be a bit dodgy, don't do it?
It makes it very difficult because it knocks everything out of balance. Of course, for us, the overwhelming evidence is on our side. However, that's not enough for many people. Celebrities, of course, when they come out, are very compelling to individuals who are possibly less well-read, less informed. So yeah, it makes the job very difficult. I think what we've got to acknowledge today is that we're working in a very different setting than we were 30, 40 years ago. The social media platform allows anyone basically to engage in this discussion, which is something that is absolutely right. Everybody should engage, including the people that are affected, like Allona. And I have my sympathy is with her, but the difference here is that the risk of the disease far, far, far outweighs the risk of the vaccine. Mm-hmm. That's something that we need to keep in mind whenever we have these discussions. Okay. I don't want to go toe-to-toe about sanitation because I'm sat here in Europe. We have explosive measles outbreaks that have claimed over 40 deaths just in the past few months. So to tell me that it's only low sanitation areas that are affected by this disease, I mean, I'm sorry. We have Germany, the UK, Italy, Romania, Ukraine with explosive, and I'm talking tens of thousands of cases. So measles doesn't consider borders or sanitation. Measles is entering a room 2 hours after somebody with measles has had measles in the room, entering the room and contracting a very dangerous disease. This is not something that we should take lightly.
Okay. Unfortunately, I've got to move on, but it's been really good to have all of you on the program. I appreciate you all taking the time. Rob Butler, Allona Lahn, and Dr. Riko Munaraka, thanks for joining us here on the Newsmakers.